Good day to each and everyone. This is Blossom Samasan of Section AMGO4. So to continue our group's discussion, I will be tackling about cerebral palsy. But before anything else, please excuse the unnecessary background noises that you will be able to hear during my presentation. All right, let's start. So what is cerebral palsy? Cerebral palsy is also referred to as CP. It is a group of disorders that affect a person's ability to move and maintain balance and posture. So CP is the most common motor disability during childhood. The word cerebral means having to do with the brain, while the word palsy means weakness or problems with using the muscles. So basically, CP is caused by abnormal brain development or damage to the developing brain that affects a person's ability to control his or her muscles. All right, next one. Doctors classify CP according to the main type of movement disorder involved. So, depending on which areas of the brain are affected, one or more of these following possible movement disorders may occur. First one, we have the spasticity. So, this means having stiff muscles. Second one, we have the dyskinesia. It means having uncontrollable movements of the body. And third one, the last one, we have the ataxia. It means having poor balance and coordination. All right, so we have also here the four main types of CP. First one, we have the spastic cerebral palsy. Second one, dyskinetic cerebral palsy, ataxic cerebral palsy, and last one, we have the mixed cerebral palsy. All right, let's discuss these types one by one. First one, we have spastic cerebral palsy. So this is the most common type of cerebral palsy. Now, spastic CP affects about 80% of people with CP. Now, people with spastic CP have increased muscle tone. This means their muscles are stiff, and as a result, their movements can be awkward. Now, spastic CP usually is described by what parts of the body are affected. So we have three types. Now, first one, we have the spastic diplegia or diparesis. Now, in this type of CP, muscle stiffness is mainly in the legs, with the arms less affected or not affected at all. Now, people with spastic diplegia might have difficulty with walking because tight hip and leg muscles cause their legs to pull together, turn inward, and cross at the knees, or also known as scissoring. All right, next one, we have the spastic hemiplegia or hemiparesis. This type of CP affects only one side of the person's body. Usually the arm is more affected than the leg. Last one, we have the spastic quadriplegia or quadriparesis. Now, spastic quadriplegia is the most severe form of spastic CP. It affects all four limbs, the trunk and the face. Now, people with spastic quadriparesis usually cannot walk and often have other developmental disabilities, such as intellectual disability, seizures, or problem with vision, hearing, or speech. All right, now let's have the second type of CP. We have the dyskinetic cerebral palsy. It also includes the athetoid, chorioathetoid, and dystonic cerebral palsies. So people with dyskinetic CP have problems controlling the movement of their hands, arms, feet, and legs, making it difficult to sit and walk. The movements are uncontrollable and can be slow and writhing or rapid and jerky. Sometimes the face and tongue are affected and the person has a hard time sucking, swallowing, and talking. Now, a person with dyskinetic CP has muscle tone that can change, varying from too tight to too loose, not only from day to day, but even during a single day. All right, now let's have the third type of CP. We have the ataxic cerebral palsy. People with ataxic CP have problems with balance and coordination. They might be unsteady when they walk. They have a hard time with quick movements or movements that needs a lot of control, like writing. They might have a hard time controlling their hands or arms when they reach for something. All right, so we have also here the fourth and last type of cerebral palsy, the mixed cerebral palsy. Some people have symptoms of more than one type of CP. The most common type of mixed CP is spastic dyskinetic CP. All right, those are the four main types of cerebral palsy. Next one, we have here the causes and risk factors of CP. Now, CP is caused by abnormal development of the brain or damage to the developing brain that affects a child's ability to control his or her muscles. There are several possible causes of the abnormal development or damage, but people used to think that CP was mainly caused by lack of oxygen during the birth process. Now, scientists think that this causes only a small number of CP cases. The abnormal development of the brain or damage that leads to CP can happen before birth, during birth, within a month after birth, or during the first years of a child's life while the brain is still developing. CP related to abnormal development of the brain or damage that occurred before or during birth is called congenital CP. The majority of CP, which is 85% to 90%, is congenital. In many cases, the specific cause is not known. A small percentage of CP is caused by abnormal development of the brain or damage that occurs more than 28 days after birth. This is called acquired CP and usually is associated with an infection such as meningitis or head injury. All right, now let's have the last part of my report, which is the treatments for people with CP. Now, there is actually no cure for cerebral palsy, but treatment can improve the lives of those who have the condition. Now, after a CP diagnosis is made, a team of health professionals work with the child and the family to develop a plan to help the child reach his or her potential. Now, early intervention, supportive treatments, medications, and surgery can help many individuals improve their muscle control. Treatment may include physical and occupational therapy, speech therapy, drugs to control seizures, relax muscle spasms, and alleviate pain, surgery to correct anatomical abnormalities or release tight muscles, braces and other orthotic devices, wheelchairs and rolling walkers, and communication aids such as computers with attached voice synthesizers. All right, that's all there is to my part. Thank you so much for listening and God bless us all.